If people are constantly gossiping about my situation and I allow it to disturb me, I will only be causing more problems for myself. Truth is, there's little I can do. I cannot farm on my own, so I rely on other people. If I am hungry, I go to them, and if there's something they can give me, they do. I'm just managing little by little until the time comes for my maker to call me, because I really cannot force anything.
The plight of a 79-year-old waiting to die. A painful mixture of abject poverty, a lack of information about the deadly pandemic, and living with obstetric fistula for more than 30 years. That is the story of Abongo Kunu. She resides at Pungu in the Kasina Nankana municipality of the Upper East region of Ghana. Abongo developed this medical condition when she was delivering her 7th and only surviving child. During the difficult and prolonged obstructed labor, which she endured without the support of timely medical treatment, Abongo started leaking urine, feces, and sometimes both. Every year, between 50,000 to 100,000 women worldwide are affected by obstetric fistula. The World Health Organization estimates that more than 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. Obstetric fistula is also a major cause of maternal deaths. The magnitude of obstetric fistula in Ghana is unknown, and out of all the health facilities that provide delivery services, only 6% provide treatment and repair of fistula. That's according to a 2015 Ghana Health Service report on the incidence of obstetric fistula in Ghana. In 2014, Ghana constituted a national body, the Obstetric Fistula Task Team, with a mandate to develop a comprehensive strategy to address the problem in the country. Apart from advocating universal formal education of all children, especially the girl child, the 4 main components outlined in the strategic plan developed by the team to address obstetric fistula in Ghana are the prevention of the VVF through increased access to timely emergency, that is, emergency cesarean section, increasing the capacity of the health system to perform surgical repair of the VVFs, rehabilitation and reintegration of cured VVF patients into mainstream society. Abongo's life of misery is not over. She has never undergone any fistula surgery. Early this year, she was scheduled to undergo an operation to repair the fistula. Then COVID-19 struck. The government instituted lockdown measures and suspended all but necessary surgeries as it mobilized health facilities and personnel to address the COVID-19 situation. Elective surgeries like the one Abongo has been waiting for most of her adult life were suspended. Elective surgeries are those that are not a medical emergency. The repair of fistula falls under the category of elective surgery. For women like her, the decision by government at that time to suspend their surgeries at the beginning of the pandemic in Ghana is both a health and human rights issue. She sees no end to the life of ostracism, stigma, and neglect that has shadowed her for the past 40 years.
Even in the presence of my family members, they say I stink of urine. So how much more when I attend public gatherings, especially funerals? People around will definitely look at me when I soil myself. My family even stares at me strangely because of my condition. People will always have something to say about me because of my situation. Unfortunately, there's nothing I can do to stop them from talking about me.
79-year-old Abongo Kono is not the only woman living with obstetric fistula here in Ghana. There are many women in Ghana whose plight have worsened due to delayed surgeries and other hospital care. 84-year-old Afarabadaga Atiru is a widow who lives in Pungu in the Upper East region of Ghana. Afarabadaga has been living with obstetric fistula for more than 4 decades. She curses the day COVID-19 emerged.
Sometimes I am tempted to believe COVID-19 is not real. It has also come to it is really because
She has lost all her 5 children. It was during her last birth that she developed the fistula, which has made her life a living hell. She ekes out a living, farming, even at her old age, and is not able to produce enough to feed herself.
I have a granite farm, but I have not been able to start cultivation on it because I feel weak. And to get laborers to work on it for me, I need money. So for now, anytime I feel fine, I try to work on the farm by uprooting the weeds. I don't have any relatives too who can help me. There's a white man here who sometimes helps the poor. It is from him I sometimes get money to buy food. Otherwise, there's no one to help me.
She depends on neighbors who sometimes give her food. Doris Funky is one of Afaradabaga's neighbors. She sometimes provides support for her.
When
I step out with her, people shun her company because of her medical condition. This worries us a lot, so we sometimes help her with sanitary pads. But that is also very expensive. We also sometimes give her food. Where she sleeps is also not in a good condition at all. She needs money to buy sanitary pads and clothes. We would be very grateful if anyone helps us to support this old lady.
Afarabadaga sleeps in a small room built for her by a good Samaritan. Her bed is the bare floor or bare wooden bench after her sleeping mat became tarted. She has never owned a mattress.
The clothes, you can see, there are only 2 clothes, this one and then. So this is how she sleeps in the night. Then when her ribs are paining her, she will put the mat on the floor. And you know the floor too is hard because it's not cement. So because the floor is hard and the dust, when she breathes, she breathes in the dust. So that, you know, the mat is weak. So when she lies, and there's nothing for her to put on top, like a blanket. She doesn't have a pillow or anything. No, right. So she just manage herself. She just manage herself. She cooks here, even the charcoal. It's a problem. You can see the guitar voice. It's just the guitar school voice. Yeah, that's guitar school, and that's even the what do you call it? The head. You can see.
She does everything on her own, from cooking to washing her clothes. Afarbadaga has never had the opportunity to undergo fistula surgery. Her only close opportunity was this year, and she was looking forward to it. According to the Ghana Health Service, even though this condition prevails in all the regions of Ghana, the northern region has the highest prevalence. Far off in the northern regions, Bandai, Nuuluga Balimbe, who is in her 50s, shares a grim story of attempted suicide. She has been leaking both feces and urine for over 20 years.
When I was affected by this medical condition, I was taken to so many places and given different types of treatments, but none worked for me. Now, it has even become worse. My neighbors and even my own children don't allow me to draw closer to them because they say I stink. Children make fun of me whenever they see me. Nobody eats my food. My own grandchildren are prevented from eating my food. Because of my situation, I think suicide is the best option to get me out of this misery. I'm even jobless. I'm tired of praying to God.
She's never had the opportunity to undergo fistula surgery. Her close opportunity was in December 2019 when she was assessed and scheduled to undergo the surgery in 2020. But that was never meant to be because of COVID-19 and the imposition of restrictions in movement in March when Ghana recorded its first case on the 12th.
I was so excited when taken to the hospital because I knew I was going to be healed. I always tell my son to call you for me. But he complains of not having airtime, and I don't have a phone. I was told the reason he couldn't come for me was because of the virus.
She has been battered by poverty over the past years, and the COVID-19 pandemic has exacerbated her plight. Few minutes into my interview with her, Nuuluga started leaking. Joseph is Nuuluga's last son. He had to drop out of school due to poverty. It was while giving birth to him that Nuuluga developed a fistula. Joseph lives with the guilt of being the cause of his mother's condition and the taunts he gets from the community.
When I was a child, my mother told me that she developed a medical condition as a result of my birth. During my schooling days from class 6 to junior high, they accused my mom of being a witch. They also said my man had cast a spell on me, so they shunned my company. I was ridiculed by my schoolmates because of my mother's medical condition. Even at home, neighbors accused me of being the cause of my mother's medical condition.
He now does menial jobs to help care for his mother.
Sometimes it is difficult to get food to eat. Neighbors rain insults on us before helping us when we seek help from them. Because of my mother's condition, I had to drop out of school. I now read to support my mother and the family. Money to buy airtime is even a challenge.
Rahinatu Isahaku is a senior nursing officer at the Buya Health Center in the Bandai district. She has been mobilizing women for fistula surgeries for more than 10 years. In December 2019, she was able to facilitate the transportation of Niwuluga and other fistula patients in the Bandai district for assessment at the Tamale Teaching Hospital in the northern region of Ghana.
It's a condition that they know themselves. So if they see that they are all suffering of the same condition and seeing one to be repaired, they try to find out how did you get the solution to your problem. Then that fellow is referred to come and see me. And if that fellow comes, I also try as much as possible to let them get a solution to their problems. It wasn't easy because the last time I sent them was when the Czech Republicans were coming to do some free surgery in Tamale. That was in December. So they all came with the help of one Mr. Edie. Sent them, we bused them to Tamale. And when they got to Tamale, they only assessed them and said they should come back and they will repair it after the new year. So I was preparing them to come for the surgery after the new year, only for this corona to pop in. So I personally visit them to reassure them and also get them the diapers and some detergents to be washing their things.
Rahinatu says she is inundated with calls for help from these women on a daily basis. At the heart of these calls is the question, when will they get the operation that will heal them just like other fistula survivors?
Actually, I said they wouldn't have confidence in me again, or they've been suffering this condition and thought I was the solution to their problem, only for them to be turned out and finally corona has come to pop in. So how soon, we really don't know. So even visiting them is always a challenge. They are becoming more worried and the stress is still in them. The depression is there and the stigmatization, you can see it yourself. They call to ask me how soon, when am I coming to send them to Tamale? Would it really work for them? That's what they always ask me.
Back in the Greater Accra region, 27-year-old Mansa, not her real name, is facing her worst nightmare, a complicated labor, abandoned to her fate by her two baby fathers and waiting to undergo surgery. COVID-19 has dealt her a big blow.
Almost not certain na corona na start here. But I'm saying I no more recorded 9 cases.
That be much.
Bacha. Inti ya buy almost 1 week time. Say enzyme bra. Ya call na say
Ghana had recorded 9 cases of the virus at the time we first went to the hospital. So we were scheduled to return in a week's time. Eventually, when we went back, the cases had increased. And we also heard a lockdown was about to be imposed. We were then told to go and come back again in 2 weeks' time. Because of this, my hopes of getting repaired were dashed.
Because my but now Capia or my everyone because my friend Auntie Rose or say because of your reality.
because I believe if not for the pandemic, I would have had my surgery and also lived a dignified life. Whenever I call Auntie Rose, she also tells me that I cannot have the surgery now because of the outbreak of the pandemic and the restrictions. It is even scary to sit in public transport these days. Also, everyone is using his or her money to support health workers manage the pandemic. So all attention has been diverted to curbing the spread of the virus to the detriment or neglect of other medical conditions.
Because yareni ameka say yareni yalboni meka de na menyi se ewo ho na menji ni se wo ho be chire me friend Auntie Rosa said they no work no na me say yareni wo ho de na say yareboni.
Sometimes she's had to adopt very unhealthy means of staying without leaking urine.
Menum nso a se menum nso kese a eba kese pa nti bi o ha metumi tena o the whole day nso kra menum bi because menum nso a metumi nkoni pem.
Anytime I drink a lot of water, I pass out a lot of urine uncontrollably. So I sometimes avoid drinking water the whole day because if I drink water, I can't go in the midst of people.
Because the media nso eba kese ti metumi endum nso menum nso bo se mikita nso a metipia tabako ano ebi a menum ne the whole day.
I also avoid taking beverages. I sometimes feel very thirsty, but I'm scared when I drink the water. I cannot control myself and I will embarrass myself in public.
Mansa mistakenly attributes her condition to evil spirit.
Sometimes na me tired when say enye nyame na desire no amame because enye yare de wo me ya fa nwome ena sakola no menyem no no na.
In fact, I sometimes think that my condition is spiritual because I was not born with it. Also, when I was pregnant with my first child, an elderly man in my house hated me. I dreamt that this same man was holding a knife and threatened to operate on me and take the child away. But I told him that I will not allow that to happen and that his daughter is also pregnant with a child. So he should first try it on his daughter before he tries it on me. We fought in the dream. When I got up from the dream, since then, I've not met this man. I also used to dream that I was in a cemetery where a big hole had been dug and I saw myself falling into the hole. In fact, that man just hates me. I think it's because of all these events. That's why I've gotten this condition.
Obstetric fistula has stripped her of her dignity as a woman. This feeling of worthlessness has driven her to try to take her own life before.
Because of Sir Johnson knife, I must say,
as a woman or lady, in fact, I pity myself because of my situation. I sometimes cry when I think about all that I'm going through. And when I'm in the midst of friends and I'm crying and they ask why I'm crying, I only tell them that I have a headache. Even when I have the chance to go out, the dress I would like to wear, I wouldn't be able to wear it because of my condition. I always ask myself if I would have suffered the same condition if I were to be a man.
Madam Fubi, me to me, and maybe me to me a consocrana. Atalia was a mention, me to me, maybe some dream say, send me a bema, and Sadi way and Bamiso. May or bar, no many problem be say,
I sometimes think it's better to die because it will put an end to all this suffering. I remember some time ago, I went to buy rat poison to use. In fact, I wanted to kill myself. So I hid it among my things in the room. And at that time, there were people at home, but there was nobody in the room. I stepped out, and when I came back, I couldn't find the rat poison again.
Tama, Nandipa will fear, and Tanami Pesu will be a big home. It's time I will be a free fear, and be a madness, me Pedro, we should share them when you are my window.
The prevalence of the obstetric fistula highlights the inequalities that women and girls encounter in accessing reproductive health care. To cater for the cost of the surgeries, a special fund, the Obstetric Fistula Fund, was set up in 2018 at Access Bank to assist women and girls in need of medical treatment. Since then, a few individuals and organizations have contributed to the fund. Obstetrician, gynecologist and fistula surgeon at the Kolebu Teaching Hospital, Dr. Gabriel Ganyaglo, has been working with fistula patients for more than a decade. He is part of Ghana's Fistula Task Force team. Dr. Ganyaglo confirmed that the task force team carried out its last outreach in March at the Bole District Hospital.
Elective surgeries are cases that, as I've said before, can wait, and obstetric fistula falls under that category of surgeries that, though important to improve the quality of life of the patient, it's not a matter of life and death. And indeed, our statistics show that on average our patients have been leaking for about 4 to 6 years. So it doesn't fall under the category of cases that are a matter of life and death. So this has been the biggest impact of COVID on fistula repairs. This year in January we were in Mankasim and we did a number of cases there, and I followed it up to Saboba. We also did about 8 cases in Saboba. Mankasim we did about 12. Following on from Saboba, I was in Tamale Central Hospital where I did a lot of prolapse surgeries, and from Tamale I moved to Bole where I did some fistula repairs. I got back from Bole on the 12th of March, and I think on the 15th of March the lockdown was in effect, and it lasted for 3 weeks.
In the central region of Ghana, the majority of Ghana's fistula cases are handled at the Mercy Women's Catholic Hospital in Mankasim. Dr. Justice Osei is the medical director of the facility, where 80 fistula operations were conducted last year with the support from Access Bank, Ghana's First Lady Rebecca Akufo-Addo, and other philanthropists.
The amount involved in caring for these patients living with obstetric fistula is quite huge, and what NHIS provide is woefully inadequate. It's less than a tenth of what actually goes into the caring of such patients, and because most of them cannot afford it, we have taken it upon ourselves to normally solicit for funds to care for these women who are living with these terrible conditions. In 2019, most of our activities were funded by Access Bank, and then apart from that, we also had funds from Rebecca, the First Lady's Foundation. They also supported us with repair of some patients. Then also we had donations from various individuals and then churches, especially with respect to diapers, the sanitary pads that the patient used. So in 2019, because of Access Bank, we had were able to repair quite a number of patients. The surgeons were able to carry it out free of charge for those patients in 2019.
Abena Menyamewu lives at Imuna in the central region. She is one of the 80 women who were fortunate to have undergone the life-changing surgery at the Mercy Women's Catholic Hospital in Mankasim in 2019.
I wasn't afraid to undergo the surgery because it wasn't my first time too. You'll have to be operated on to be healed. In fact, my situation is better now. God has been good.
As of July this year, over 40 fistula patients were on the hospital's waiting list.
So in January, that's before COVID came to Ghana, we operated on about 15 patients, and we were looking forward to carry the second repair somewhere in latter part of March to April. But unfortunately, when COVID came, and since it was a new virus and we didn't know how, in the form in which it was going to take, we decided to put a halt to the fistula surgeries and then find out what will happen later on before we start with the surgery. And I must say that it's not only COVID that has prevented us from carrying out the surgeries, but as I'm speaking now, funding for the surgery itself is also a major challenge for us. Currently, we have over 40 patients on our waiting list, and some of these patients are new and then others are old. When I say old patients, what I mean is that the surgery is not 100%, it's not 100% successful. So some of them do fail, and then for those patients, you have to bring them back and then carry the surgery out again for them. Sometimes we can even go on for about 3, 4, 5 sessions before the person is healed. So we have a lot on our waiting list together with new patients.
Dr. Barnabas Nagandao is an obstetrician, gynecologist and fistula surgeon at the Tamale Teaching Hospital in the Northern Region. According to him, the hospital identified over 60 women who were scheduled to undergo surgery this year. These operations have also been suspended, and the women are waiting in limbo, not knowing when they will undergo surgery.
There was a team that has been planning to come and do mass surgery, and led by Wilder. So we had the enthusiasm that by the end of last year, 2019, we would have had all the statistics of cases that we could do in the first or latest second quarter of 2020. Unfortunately, as we were putting the place in order, because we have over 60 patients that are confirmed to be fistula and waiting. It is some of those that came at the very end of last year but could not be done. These were confirmed, and we still have a number of cases that reported upon hearing that over 60 patients had been booked for surgery in 2020, early 2020. They had also come and then yet to be assessed and then prepared for surgery.
Esinam Ahiadome is the Programs Officer for Governance and Health at Women in Law and Development in Africa, World of Ghana. Her organization has supported and promoted the cause of girls and women in Ghana since it was established in 1991. Last year, WorldAF, with the support from African Women Foundation from Spain, launched a project for fistula surgeries and awareness in the northern region of Ghana.
We are currently running a project being sponsored by African Women Foundation from Spain, and we are doing it in collaboration with UNFPA and Tamale Teaching Hospital to help women with fistula to do the surgery for them and also create awareness on the situation. As you may be aware, the perception out there with the public is that most often some of these fistula cases are cases, either cases or as punishment to the women who have committed some adultery or some other things against their husbands.
She also disclosed that health experts from Spain were scheduled to come in the country to undertake 100 fistula surgeries from the 5 regions of the north in Ghana with a task force team in Tamale. But this plan had to be put on hold as a result of the COVID-19 pandemic and the closure of the borders.
As we speak, there has been a hold on it because of COVID, and the whole idea is that there were supposed to be experts from Spain who does those surgeries. So the experts were supposed to come down, meet Dr. Gandao and other experts in the northern region to come together as a team to do a surgery for at least 100 women. So it was supposed to be done in badges. We are looking at between 30 35 per each surgery. So we are looking at 3 surgeries in all. And unfortunately, they themselves as pain has been very much
badly hit by the pandemic.
So
there are fears that sponsoring agencies would withdraw funds set aside to support the surgeries and other related costs of treatment for these patients. Here is Dr. Gandao explaining the situation.
I'm wondering, many people keep calling the nurses, the NGOs that mobilize them, preparing for surgery. Some sponsoring agents are also considering withdrawing their sponsorship because most of these programs are time-bound. Funds released, if not spent, will have to go back and replan or rebudgeted because those organizations cannot keep waiting for us to allocate time for their job. So fistula patients have been calling, have been asking, are worried.
Program officer at Wildaf, Esina Mahiadome, is optimistic that would not happen.
We have been in talk with them anyway. They have not called off
the support.
What we did was to quickly get in touch with the donors. And it's something, because the pandemic is across the world, it's not related to one specific country. The donors understood the situation we found ourselves.
She admits the project did not factor unforeseen challenges like the COVID-19 pandemic to put in place some relief packages for these women in the form of provision of sanitary items and stipend while they wait to undergo the surgery.
We didn't have any unforeseen, in case of, in fact, for COVID, nobody thought of it anyway. We also didn't know that we were going to have this kind of interruptions here and there. So the idea is that we identify within a matter of a week or two, we are bringing them, and when they are fine, we feed them everything. When they are fine, we give them skills training, and that has been the whole thing. When the COVID came, we were personally, I have been trying to see if I will get some response, COVID response fund to these people, so that at least we get sanitary pad for them. Unfortunately, my sister, it has been difficult. You go to certain offices, and when you mention fistula, the first we are talking about COVID, you are still talking about fistula. And then it breaks your heart because they are not linking. People are not linking the challenge they are facing in the midst of COVID.
Still in the northern region of Ghana, the Yendi Municipal Hospital attends to cases from 10 districts. Dr. Ayuba Abdullahi is a medical director at this facility. He is also an obstetrician gynecologist and a fistula surgeon.
Okay, good.
He says the hospital carried out about 30 fistula surgeries in 2019 alone.
What we do is that we really don't book them per se and do, but as and when they come in, it's an open door. So it's all about advocacy, how the advocacy, the people will get to know that there is a surgeon here who can help them do. In the past, UNFPA used to do that by sponsoring the district directorate and other staff to be really going to the rural areas to get them to come. So you can see that that's more or less dying now. So some of us as busy person here, I don't go to search for them, and that is what the recruitment of the patient is not my mandate. But when they come here, when they come, they are fit for surgery. We admit them and prepare them and do the surgery, and that's how we have been doing. So far, I think 2019 we do almost about 30 cases and other stuff.
Abongo Kunu, Afarabadaga, and other fistula patients dotted across the country are desperately waiting to have their surgeries so that they can be lifted out of their misery. For them, the surgery is a matter of living a life free from stigma and loneliness. But there is hope for Mansa now, as her prayers have been answered. She was part of the 10 fistula patients who had their surgeries at Mankasim in the latter part of August. For Mansa, the call from the nurse at the facility should have ended her woes, but it did not.
tea a corner and me there by a train. I'm a ransom. Was naming me to come in the bell or a fair at the other. Ain't he? Now, Danny, I don't dream soon. You need some for a Monday and the Tuesday.
After the call from the nurse, I was happy because my time for surgery had finally come. But I also became sad because I had no money on me I could use for transportation. Because of this, my joy turned into tears.
It's me quite on to say we need this or Bisa, Madame Fubisa, Benya Bessia, and the Amamiana. The nurse said, Prior friend me say, if it's to an event, remember near main count, and I am there by Lord Fainty. That's I am my dream.
Weeks after the surgery, she also admits the significant change the surgery has had on her.
My margin said me qua, sorry, I soften her. Never dinner master or my dinner, sorry, dining, sorry, demo. Now
that I am healed, I have resolved to go to church to share my story and also advise people with this condition to seek treatment. In fact, I am not shy to share my story in public because I know it would inspire others.
Here is Medical Director of Mercy Women's Catholic Hospital, Dr. Justice Osei, explaining how it was possible for Mansa and other few patients to have their surgeries at the facility.
So what this time around we decided to do was to operate on mainly those who have not had the surgeries before, like those the new cases.
For the other fistula patients on the waiting list, their fate no longer hangs on COVID-19 and the restrictions earlier placed on some surgeries, but the benevolence of individuals and organizations to fund the processes for their surgeries.
Nothing has changed much. The funding has been a very big challenge for us. This particular surgery, we had some organizations coming to help us. Sema Club decided to visit us and then promised to sponsor 10 patients, and actually they paid for repair of 10 patients. Sema Club is an NGO of well-meaning Ghanaians who are residing in Sema, and they decided to sponsor 10 patients. And apart from that, also other philanthropists also came in to support 1 or 2 patients. So that has been the story so far. But going forward, funding is still our number one challenge. And to me, I would say that even supersedes COVID, because if we have funding, we will be able to operate the numerous patients that are on our waiting list. So we are still appealing to individuals and well-meaning Ghanaians to try and help so that those women who are living with this unfortunate condition through no fault of theirs, but as a result of bringing forth to the next generation, they've suffered this horrible condition, will be able to put smiles on their faces. So yes, funding is still a major challenge for us. But luckily for us, through our intervention and then advocacy by our administrator, we're able to get that organization to come to our aid. So as I've always been saying, whichever platform that we get, we always solicit for funds to help us. So yes, we took the initiative to start the surgery, but their support also came in very handy to come and then push us forward to have the surgeries done for those 10 patients.
For Mansa and the rest who have had their surgeries and recuperating, another challenge awaits them. getting on with life after surgery. But in the case of 84-year-old Afarabadaga Atiru, who is yet to be operated on, it is time to confront her fears and stand up against all forms of stigma.
When I sit on a chair and get up, no one wants to sit on it. At church, people don't know about my condition, so they don't discriminate against me. During the service, I keep going out to urinate, so mostly people wonder why I go out so many times, but that's all about it. However, in the community, when I attend gatherings, sometimes I get angry and leave because of the way they treat me, even though they know I was healthy until this unfortunate tragedy hit me.
It is not the same for 55-year-old widow Akunle Alukuja. Her first corrective surgery was unsuccessful some 10 years ago. Her fistula did not close after the surgery, and she continues to suffer from incontinence. Alukuja is among the very few women, less than 3%, suffering from fistula who may require repeat surgeries to correct the problem. She says she was not told why the operation did not work for her. That experience left her furious.
So far, my surgery has not been successful, and I just don't understand it because the other women I went to the hospital with have had their condition repaired. And in fact, I wasn't even told why mine wasn't successful. I think I'll just leave things the way they are because I feel nothing is going to change.
But Akunle has accepted her fate. Not much will change, she says. For Afarabadaga, despite her helpless situation, she remains grateful and optimistic.
84-year-old Afarabadaga Atiru, singing her heart out, thanking God for bringing her this far. Despite the situation, she still remains positive and she's grateful to God. She's not had a rosy life, but she still remains positive. I'm told this song is in Kasim and literally says, I thank God for bringing me this far. If not for God, I would have been dead by now.
For a condition that is almost entirely preventable, its persistence is a sign of global inequality and an indication that health systems are failing to protect the health and human rights of the poorest and most vulnerable, women and girls. She also believes a lot of awareness has to be created to demystify the myths surrounding the condition. This, she says, would help the fistula victims to openly come out and seek treatment.
So I think that going forward, one of the things we can do to help them most is to do a lot of awareness creation where people can, like HIV is, people can openly come out to say that I am HIV patient. These people should also be able to come out to say that I am a fistula patient without any stigma. And even if there is stigma, they will be able to manage it. Wow. I think that is the biggest problem they have. And maybe that is why a lot of organizations and governments are not able to be identifying them and give them any support to them.
For now, however, As the COVID-19 pandemic continues to ravage economies around the world and place a huge burden on health systems in Ghana, these fistula victims have to bear the brunt of the pandemic. As Ghana hopes and prays for the vaccine developed to reach Africa soon, the plight of Afarabadaga, Avongo, Niwoluga, and other women still living with obstetric fistula should not be relegated to the background, as preventing and managing this devastating medical condition contributes to the attainment of Sustainable Development Goal 3 of improving maternal health. Beryl Ernestina Richter is a fellow of the African Women Journalism Project. This report is supported by the Africa Women Journalism Project in partnership with the International Center for Journalists, ICFJ.